Over the past several years, we've seen significant advancements in the science of cannabinoids, from deeper understandings of the endocannabinoid system to emerging clinical data to new formulations and delivery methods. The final session is about moving from knowledge to implementation. It's about ensuring that scientific discoveries aren't just published, they're practiced, and that patients, especially those with complex or chronic conditions, can access medical cannabis therapies in a way that is safe, evidence-informed, and integrated into mainstream clinical care. I am pleased to welcome Dr. Jennifer Baumbusch, a leader in nursing research and a champion for person and family-centered care in aging populations. Dr. Baumbusch is a professor at the School of Nursing at the University of British Columbia and a former CIHR Chair in Sex and Gender Science. This is a timely and important topic. Older adults are one of the fastest growing groups of medical cannabis users, but they also face higher risks due to polypharmacology, age-related physiological changes, and limited clinical guidance. Dr. Baumbusch has led research into cannabis use among older adults, many of whom are returning to it for pain, insomnia, or chronic illness relief. Her insights are crucial to understanding use patterns, key risk factors, and best clinical practices for older adults. Although Dr. Baumbusch could not join today, she is here through video. Thank you.
Hello, and thank you for having me with you today. I'd like to thank the conveners for allowing me to join virtually to this very interesting conversation that you're having today. And the focus of my talk is around cannabis use among older adults, current research and implications for clinical practice. So when we think about older people using cannabis, I think a lot of us have this picture in our head, those aging hippies who started using cannabis in the 1960s and 70s and are still continuing to do so today. And I think while some of them are starting to use cannabis as well for medical reasons, they were starting out as recreational users. But the reality is that the older people that are starting to use cannabis in later life are more like this, the ladies in the local knitting and quilting clubs. The reason I became interested in this topic is because I was chatting with my aunt one day, and she is in her 70s, a very conservative woman. And she said, "Oh, I'm just waiting for your cousin to come back with my cannabis." And it just stopped me in my tracks. And I said, "What are you talking about?" And she said, "Oh, I've started using cannabis for pain." And I was so surprised that I started to talk to other people about this. And a lot of people who are around my age were saying, yeah, our moms and dads and aunts and uncles are all starting to use cannabis for various reasons. And I thought, I think there's a research study here. And it got me into learning about cannabis and doing research. And I'm going to talk about the study I conducted in a little while. But first, sort of set some of the context for what we're talking about today. So I'm going to begin by just talking about the context of cannabis use by older adults. The focus of my work and interest is really among those new users, people who start using in their 60s and 70s and 80s, and believe me, even in their 90s. These are the people that I'm quite interested in learning about. I'll talk a little bit about current research and usage statistics. I'll share findings from the qualitative study that I conducted pre-pandemic, and then talk about some of the clinical implications when you're working with older adults, particularly those who are new users of cannabis. So this is sort of the thesis that I've come up with working in this area. And I'm hoping that by the end of my talk, you'll agree with me, or at least think, yep, Jennifer's on the right track around some of this. Older adults who are new users of cannabis are using recreational cannabis for medicinal purposes. And I'll talk about the research that demonstrates this and from my own work. But healthcare professionals ought to be facilitating medical cannabis use for older adults in this situation. And that's the piece I'm hoping by the time we're done that you will be agreeing with me about. So where do we start? I realize that most of you will already know this information. For me, it was a big learning curve. I'm a gerontological nurse by practice. I've worked with in the area of nursing care of older adults for 30 years, but didn't really give a lot of thought to cannabis use or substance use for most of my career. So I had a big learning curve around what is happening with cannabis in Canada. And some of the key dates that many of us are familiar with is that in 2001, legal access to use cannabis for medical conditions came into practice in law. And then in October 2018, there was legalization of recreational cannabis. And this is where we start to see an increase in cannabis use among those older adults who had never previously used cannabis in their life. And then in October 2019, there was legalization of edible cannabis. And when we look at older adults are more likely than any other age cohort to obtain cannabis from a legal source, with 41% using only legally obtained cannabis. So, two things to take away from this: 41% is still under half. So, it's still under half of older adults are using only legally obtained cannabis. And I think we definitely like to see that increase, for particularly for those who are using it for medicinal purposes. And I use the word medicinal very purposefully. I see there's medical cannabis, which people are authorized to use, and a lot of people will be using cannabis medicinally, but not with authorization. And the other piece is that older adults really want to purchase and obtain cannabis legally. And so we do have an obligation as healthcare professionals to be facilitating that for them when we can. Also, older adults are among the fastest growing user group of cannabis. And so when we think about keeping track and on top of this, it's really important that we're making sure that we're opening avenues for them, helping through education, et cetera, for them to be able to obtain their cannabis legally. So I've already foreshadowed this around medical cannabis, which is authorized by a healthcare provider, either a physician or a nurse practitioner. And then that individual obtains the cannabis from a licensed producer, or they register to grow it themselves or designate a person to produce their cannabis. And then with recreational cannabis, they obtain it from a licensed retailer or regulated dispensary or non-licensed retailer. So that could be a storefront or from, the classic person on the street corner. Um, and the really important piece around this is that recreational cannabis can be marketed for recreational and social use and also for medicinal use. So that's where my word medicinal comes in that older people are purchasing to the best of their ability from a licensed retailer, but oftentimes they're purchasing recreational or social cannabis for medicinal use. So I'm quite interested in this aging group. And so the statistics that I talk about are mainly about older adults. I know that some of us don't think that 55-year-olds are part of that. But as I got into this work, it was really interesting talking with people in Statistics Canada, because I would say to them, I'm really interested in the 60 and 70 and 80-year-olds. And they were not always able to look at that population in the studies that they were doing. So oftentimes in the literature, when you look at research, what researchers are calling older adults are really an age group that starts at 55. And then once we get up into the higher age groups, it's a little bit more challenging. So this is a study that just came out this year, and it does a really nice job of just laying out how cannabis is being used by older adults in Canada. So in the first year post legalization, so we saw that in 2019, cannabis use increased by 24.5% in this age group, compared to a 19.3% increase in 2018. So once those floodgates opened to be able to purchase cannabis recreationally and without medical authorization, people were ready and waiting to do so. And this becomes really interesting too. So then they ask people, well, are you using the cannabis recreationally or for medicinal purposes? And they call this a medical consumer. And so self-identified as a medical consumer, and this was in 2019, 34.4% of women said, yes, that's who I am, and 21.1% of men. But again, really interesting to see, being authorized for medical cannabis consumption was a different issue. And so of those people that said, yes, I'm a medical consumer, less than half had medical cannabis authorization. And that held true for both women and men. So again, we see an increasing group of older people using cannabis. They want to be using it for medicinal purposes or medical purposes, but the number and percentage of them who actually have authorization for that purpose is much lower than we would expect. So I'm going to continue on into this issue and area of current research and usage statistics. But I hope that lead in kind of got you thinking, yeah, I can see what Jennifer's thesis is all about, and probably she's on the right track. So back when Statistics Canada was conducting their Cannabis Hub research, which was a great resource, I was able to ask them to take data from 2018 and 2019 and break it down even more for me into that older adult population that I'm really interested in. So when they started to do that, and this was a specialized chart that they did for me, you can see that from that first quarter of 2018, before that legalization happened around quarter 3, we were sitting for adults over 65 around 4%, and adults 55 to 64, which is the orange line, 9.4%. And it bumps along fairly steadily. In 2019, clearly a lot of those 55 to 64-year-olds, after that legalization happened in quarter 4 of 2018, went out and got themselves some cannabis. We don't see as big a bump in the adults age 65 plus at that time. And then if we look a little further along, it dips again. And in that quarter 4, where we would have seen the legalization of edibles, we again see that 10.7% and 6.10%. I think that over time, this ebbs and flows, obviously. And we see over time that slow increase across both of those cohorts. Unfortunately, the Cannabis Hub ended just pre-pandemic. And so the numbers don't get to carry on through 2020 beyond. But this was another breakdown I asked for them to do in that quarter 1 of 2019, where we really looked and took a deeper dive into that older adult age group. So for those of you who work in the area of geriatrics or gerontological nursing, you'll see that I asked them, I said, you know, it's great that you have this sort of overall group of 55 plus or 65 plus. But when you work with this population, it's a very diverse and heterogeneous population. So could we do a little bit more of a breakdown? And so they did that for me. And they broke it down to the 55 to 64-year-olds, and then the 65 to 74-year-olds, and then the 75 plus. And they weren't able to do further breakdowns for the 75 plus because they didn't have a large enough sample. But you can see in this, it breaks down between women and men across all age groups. So all ages, no surprise that more men than women were using cannabis at that time. And it carries through, but some of those differences between the genders start to thin a bit. And I think that this points to a really important and interesting area that older women are really interested in using cannabis. And we start to see those numbers start to even out as people get into those older age groups. Currently, cannabis use in Canada is monitored by CIHR, the Canadian Institutes for Health Information, and they produce this based on their 2021 data. So not that much longer than further along than the data from the Cannabis Hub from Stats Canada. But again, you can see some of those age differentials across the life course. Obviously, sort of that young adult group are the highest users. And as we move into the 50 to 64 and 65 plus, it starts to drop. About 18% in that 55 to 64-year-old group and 8% for the 65 plus. One of the challenges around this is, and unknowable, is that, of course, COVID-19 public health measures went into place in the end of the first quarter in 2020. So we don't know how that impacted cannabis usage. And I suspect that over the next few years, we'll be able to see some trends related to that and see if once the public health measures really lifted, if those numbers for older adults continued to go up. So that is sort of the overview of the current statistical breakdown around usage. And then, like, why are older adults drawn to using cannabis? And the first study that I have in this slide is a nice study by Yang et al. And they looked at 568 older adults who attended a geriatric clinic. And they found that over 3/4, when they asked people, why are you using cannabis, over 3/4 talked about using it for symptoms like pain and arthritis. So very targeted conditions and symptoms that older adults thought that the cannabis was going to help them with. 29%, so almost a third, were using it for sleep issues. A quarter were using it for anxiety, and about 17% for depression. So that runs fairly consistently with the rest of the literature around why older adults are using cannabis. And then the clinical research areas of focus, and each of these is sort of its own area of research. It's being conducted around treatment for glaucoma. That's a longstanding treatment area for cannabis, pain management, using it as a sleep aid, an appetite stimulant. And then for people living with dementia, research has been done around whether or not cannabis use will help with agitation, with anorexia, helping to promote eating, and then with sleep disturbances. So there are little pockets of research in each of these areas. Other areas also include if it assists with tremors from Parkinson's and different types of cancer. So that is sort of the state of why are people using it. This is another really nice and recent study from Wolf et al., and it's a scoping review of a number of studies. And they found that cannabis use was often mixed. Not surprising when they asked people, what kind of cannabis are you using? It was often unclear if people were using medical or medically authorized cannabis, non-medical, or what it was. Because as my research that I'll talk about in a couple minutes shows, oftentimes the user is very confused about this as well. Many of the findings were from only single studies, non-randomized designs, and were quite minimally informative for causal inferences. And very few studies specifically focused on cannabis use among older adults. And certainly I found this across the studies that I've looked at over time, is that there were 134 studies included in this review. The focus was older adults, but that didn't mean the study population was only older adults in these studies. So these researchers really had to pull out the older adult data. And in this, the inclusion criteria for that was age 50 years and older, in order to look at what are those impacts for that older adult group. But what they found was that in terms of potential adverse clinical outcomes, physical outcomes were accidents or injuries. This may be related to confusion or sort of a lower area of focus that people might have. They might fall. And so they could suffer those accidents or injuries when using cannabis. They saw emergency department visits due to cannabis use and poor health related quality of life. And then in terms of mental and behavioral potential adverse clinical outcomes was that people felt they were actually more anxious, and this was self-reported. So a lot of this data is self-reported, but people found that they were more anxious, that they were experiencing depression. Some people had a major depressive episode, but much of it was also self-report. People were driving under the influence. And of course, this is an area of great importance that they might be out driving and also causing potential safety risk to others in addition to themselves, and then impaired cognitive function and concentration. So I think those are really important outcomes to consider when we're thinking about older adults and their use of cannabis. So I'm going to shift now to talk about the study that I did conduct. It was pre-pandemic. I think that, as many of you will know, when COVID started, a lot of research shifted and got dropped. But I still think that this is a really important area of research and really needs more focus to continue to explore these issues around cannabis use with older adults. So the study resulted in a couple of publications. And so, in terms of the research question, we were really interested in what are community dwelling older adults' experiences of using cannabis for the first time in later life. And I was looking at age 65 years and onwards. So, when we were recruiting people to the study, one of the inclusion criteria was that they were 65 years or older and they didn't have a history of using cannabis. And this narrowed the field quite a bit because, of course, there were some people who said, well, I tried it in the 70s. And so we were really interested, though, in the people who had no previous experience. And in terms of the methodology, it was a very straightforward, exploratory, qualitative study. There isn't a lot of research around this topic. There are studies at that time from the United States, of course, and different jurisdictions where cannabis was legalized or particularly medically legalized, but not a lot in terms of the particular context that we had in Canada, where recreational cannabis was legalized and people were using it for medicinal purposes. We tried recruiting across Canada, but most of the participants, of course, were right here from BC, where I'm located, particularly in Vancouver, and we interviewed them, and people had a lot to say. You'd be surprised. And we asked them about how they came to use cannabis, how they were currently using it, and how they had experienced it. And so I'm going to share some of the findings from that study. We only had 12 participants, which for a qualitative study, it was small, but the findings, the stories that we heard were very consistent across the participants. And I think we would have continued on recruiting and doing this research if we hadn't bumped into the pandemic. But that kind of shifted a lot of things again for research. So we ended up with 12. We had 10 women and 2 men. And I think, again, this speaks to a couple things. One, that women tended to be these new users, right? They had never used cannabis before. And so they were interested in being part of the study. And also that in qualitative research, oftentimes we have more women in our studies than men. And that's something that we're always working on to address. So we did have that gender difference in the study. The age range was 71 to 85, and the average age was 75. So I was really getting into that group that I was really interested in, which were people in their 70s and 80s who are new users of cannabis. In terms of living situation, more people lived alone than lived with other people. And this was a fairly well-educated group. So, you can see from that, 9 of the participants had completed a university degree. So in terms of reasons for using cannabis, when this is from one of our participants, and he said, I'm taking it purely for medicinal reasons, but I wouldn't take it recreationally. And so one of the things that all of the participants were quite clear about is they were very focused on taking cannabis that was a CBD product and not THC. They were not using it to get high. They were using it for a medicinal purpose. And so you can see my note there that while all 12 of those participants were using cannabis for medicinal reasons, only one had authorization for medical cannabis. So that was really interesting to us to learn that people were going out and seeking this on their own and figuring it out within their social networks how to get cannabis, and were using it for a variety of reasons. And the top 3 reasons that people in our study were using cannabis was pain management, sleep assistance, and an alternative to prescription or over-the-counter drugs. So again, very similar with the extant literature. We asked people the route for taking cannabis. People had tried lots of different things, so they weren't single route users. They were going to try different things until they found something that worked. In terms of the perceived effectiveness of cannabis, again, quite mixed. Many of them had a positive, some had unwanted, some had like, this did nothing for me, and then some were unsure. And so an example of that unwanted effect was dizziness. And so we thought that was really interesting. And we asked them about that a bit more. And so you can see from these 2 quotes quite a big difference. So this person said, well, the first batch or the first purchase they made didn't make me dizzy. And it was the second batch that made me dizzy. So they were concerned about, what is actually in this product that I've purchased. And then another participant said, it's just so great. It just takes the pain away. So very different kinds of experiences. So this led our team to say, would you show us what you're using, because we were like, we're just hearing really different stories about it. And we started taking pictures of the cannabis products that the participants were using. And you can see on these very minimal labeling. You don't really know what's in any of these. And this is the type of product that older people are being advised to use when they go to purchase it in one of those licensed stores or an unlicensed store. So this is deeply concerning because, again, working with older people, we really need to know what they are consuming, and this is just not adequate. And again, you could buy that package of 50 milligram capsules one day and then go back in a couple months and purchase it, and it may not have the same effect. So, in terms of how people were getting their cannabis, again, it was a mix. People tried different things. Only one person was obtaining it from the pharmacy, and obviously that was a person with medical authorization. So 10 of the participants had purchased cannabis themselves, and 5 had a family member or friend purchase on their behalf. And so again, this is really important. You're sending your son or your friend off to make this purchase for you. You're not actually seeing what's on the shelves. You're not talking to anybody about it directly. And there's also rules around how much a person can purchase on their another one person's behalf, which I'm not sure anybody involved in this were really clear on. And 6 of the participants got their cannabis from an unlicensed store. Again, very important that people, I mean, if you visited Vancouver, you probably know, how would you know what is a licensed or unlicensed store? How would you know how to ask those questions as an older person? So this was concerning because where people were getting it was quite different. And then the sources of information about cannabis, and I'll let you read this. It's a very nice little story about how helpful the person working in the cannabis store was when this person went to go purchase something. The top sources for information about cannabis reported by participants were their social network, media, and cannabis store staff. You'll see who's glaringly absent from that list are primary care providers. So in only one case, a person, and that was a person who had the medical authorization, had talked to their medical, had been given authorization by their medical provider. A couple of the participants, when they tried to broach the subject with their medical provider, they just laughed at them and said, "Oh, you don't need this," or "Oh, I don't know anything about that," and didn't actually engage with that participant around their cannabis use. So not surprisingly, they left that appointment deciding never to talk to their primary care provider about it again, and went and purchased it where they could find it, because it was not a deterrent for them to use cannabis. So I'm going to wrap up now, just talking about some of those clinical practice implications for older adults' cannabis use. Again, really thinking about those people who are new users and who are in that age range over 65 and are looking to use it for medicinal purposes. For considerations for practice, screening. We should be screening everyone for cannabis use, just as we do for alcohol. I think sometimes we make assumptions about the person, their background, how they look, who they are, about whether or not they'd be using cannabis. And I can definitely say you'd be surprised and indeed shocked sometimes around who is using cannabis. So definitely screening, and also trying to do it obviously in a non-stigmatizing way. Doing patient and caregiver education. So really advising people on good practices for purchasing. How do you know if it's a licensed store or not? Those are important things that people need to understand. They should understand the risks, particularly for falls, those accidents and injuries, polypharmacy, where people may already be taking a bunch of medications that are prescribed, and then adding cannabis to that can be maybe not a good idea. And then the impaired driving, that people really understand that they should not be using cannabis and then driving if they're impaired. There are really good Canadian guidelines on cannabis use disorder among older adults that clinicians who work with older adults should be familiar with, and those are available online. And then really considering authorizing for use, or referring them to someone who can and will. And I think there are clinicians who have specialized interest in working with older adults who are cannabis users. And if they can be referred to so that someone can be authorized and obtain their medical cannabis from you know respected source. I think a lot of older adults are happy to get it at their community pharmacy. That's what we should be doing. So just a couple more in terms of best practices. So there are general guidelines for best practices for medication use in older adults. Obviously, always asking about cannabis use as part of medication reconciliation. Really using that geriatric medicine prescribing principle of start low, go slow. We do that typically anyways, and so following that for cannabis. And really considering absorption of various routes. Again, clients, patients may not know that there's different absorption rates for different types of use. When talking to people who are taking other medications or substances, knowing that cannabis use can increase the risk of overintoxication, they can have negative health effects if they're using it from inhalation or smoking, and that we can see those drug interactions. And I also add this, that if you look after people who live in long-term care homes, assisted living, or retirement homes, whatever those congregate living situations are called, include this in your practice as well. Because believe me, family members will bring in cannabis for people to use. It won't appear on their medication administration record, but it's really important information to have. And so we want to be also asking that population around their use. So that wraps up my talk. Thank you so much. If you'd like to get in contact with me, there's my contact information. And thank you again for your time.
Thank you, Dr. Baumbusch, and it's really a pleasure to hear some of this work and to see how far we still have to go. When I saw those pictures up there of that cannabis, it really made me nervous and start to sweat. And unfortunately, that is still the reality, where we do have patients who eventually do get to our platform say, oh, I tried this or that, and I had these adverse events, and unfortunately for them, it didn't work for them, or they had some kind of negative impact. So we hope that one day there'll be a point where the first point of contact is a prescriber that can direct them to whether they are eligible for cannabis or not.